Now I did. Welcome, everybody, to Trauma Training Tuesday. Thank you so much for being here. I am your hostess, Amy Ebbison, at Worcester Addresses Childhood Trauma. And our topic today is one of the most foundational traumas, food insecurity. And I'm just so grateful to be able to bring this topic to people. And I'm really grateful that we have, 25 or more people here already. And I know that the people that are here are very connected, tuned in people that are not only going to take in this information themselves, they're going to bring this information to more people. This form of trauma, if people are worried about where their next meal is coming from, what else can, like, they don't have space for much else. Like, this is so very foundational to any, how can you have any sort of mental health if you're not sure if you're going to be able to eat, right? Like, eating and sleeping are so foundational. Every time I do any work on mental health, I say that, like, no matter whatever's going on, your eating and your sleeping are going to be impacted. And if you're not able to eat, if you have no control over that, wow. I also, it's deeply important, the policy pieces, and that so much injustice is embedded in policy. And Casey gets that. I'm so grateful to her. For my dog is barking. I'm so sorry, you guys. I think I'm just gonna kind of turn it over to Casey now. I know she's gonna be able to do that because my dog is really calling for me to pay attention to him. So without further ado, Casey, thank you so much for being here. I know lots of people have a lot to say about the topic as well. So we'll just kind of take it as it goes. I'll let you kind of speak and we'll go from there.
That sounds good. Thanks so much, Amy and all for having me. So I'll do a little bit more of a formal introduction, my background, who I am in just a sec, but I'm Casey Burns and happy to be here and share this information. I am gonna present kind of an overview of the findings that we found with the community food assessment, which was a really collaborative process that happened over the last year. We just had our release last month on July 16th, so it's kind of really hot off the presses. Some of you may have seen this presentation before if you attended the meeting on the 16th or UMass Design Day. You saw some version of it a little bit earlier than that, but I always find it helpful to kind of hear it again and process it differently. I'm happy to also, kind of use this as an opportunity to hear from so many of the other experts that are in the room as well that I know are practitioners and leaders in this work. So really happy to, share this space as well. I was thinking the presentation will probably take around 40 minutes ish, but it might be helpful just to kind of go through the presentation unless there's like need for clarifications or kind of immediate questions that come up, and but then we could have more of like a broader so it might be helpful to go through it without like questions throughout, unless it's like need for like quick clarifications or things. I'm happy to pause to do that, but it might make more sense just to have more of the discussion questions element at the end, because we might answer some of the questions throughout the presentation. But if folks wanted to put questions throughout in the chat, that could be a space, a way for us to remember things, or so we don't forget them at the end. Does that make sense for kind of a structure? As I'll kind of present and then we can discuss, but please let me know if we need clarifications throughout. Okay. So I will share my screen. And let's see, do I remember how to use actual PowerPoint?
It's looking great so far, Case. You got
All
it.
right, cool. So you can see my
ask people to just introduce themselves in the chat. And I know you kind of said it, but I know we do have several people here today that are doing food policy stuff themselves, or running a food bank, or community fridges, WIC, all kinds of things. And I know you left plenty of time for other people to share their expertise and or, you know, have conversation about all of this. So I guess we can get that, we'll come to that at the end of this piece.
Yeah, if that works. I just with what I prepared, it might make sense to just go through it, and then, but like happy to also hear from everybody, of course. Cool. So, without further ado, and Amy, if there are things in the chat that pop up that I should pause for, just let me know too. I'm happy to, just because I might not be monitoring the chat as well, sharing my screen. So yeah, these are the slides that we worked and developed to present the results of this year-long process of a community food assessment. This is the first community food assessment that has been formally done in the city of Worcester, but this is a model of, there are, you know, models and practices of community food assessments that have been kind of established over the last 20 years or so, and there's some expertise out of Johns Hopkins University in different spaces that they've kind of promoted different models, and there are different takes and approaches on the ways that you can do a community food assessment. So I'll describe in just a minute the particular approach that we took, but you can tell from the title, learning from lived experience of Worcester residents, we really tried to take like a human-centered approach of what are people experiencing when they are food insecure and seeking resources and trying to meet their needs in the city of Worcester. And so this project was done with the Center on Food Equity, which is a project that is funded primarily out of the Worcester County Food Bank, Greater Worcester Community Foundation, the Prevention Research Center at UMass Chan in the city of Worcester, the Worcester Regional Research Bureau also really played a strong role in the foundational research and the steering committee for this work as well. And so our funders for this specifically were for the food assessment was the Worcester County Food Bank and the Greater Worcester Community Foundation. So we're really grateful for their support to be able to do this, because you know this kind of research doesn't happen for free, and we wanted to make sure that all of our participants and researchers and practices were funded and supported, and their time was honored for this work. So it was really critical to be able to have the funding support to be able to hire the folks with the community level expertise that we needed to do this kind of research. So just a little bit about me. I would like to center in that. My name is Casey Burns again. I identify as white, as cisgendered woman. I identify as the gender I was assigned at birth. I've been a Worcester resident for about 25 years now. Still feel like I can't say I'm from Worcester, but I am been living in the city of Worcester for about 25 years. I have my 2 kids here, go to Worcester Public Schools. I've been a practitioner of food security and public health policy and programming in Worcester for about 20 years. Previous to my current role with the Coalition for Healthy Greater Worcester, I was the director of programs for the Regional Environmental Council for 12 years, so building farmers markets and community gardens and youth urban agriculture work. I was during that role at the RAC, I was one of the founding members of the Worcester Food Policy Council, which is about 18 years old now. It's one of the first really established food policy councils in New England. To be really proud of that. I'm currently the executive director of the Coalition for Healthy Greater Worcester, but I also serve as co-chair for the Center on Food Equity in Worcester, which is, I'll explain in a minute, but this is new kind of conglomerate coalition or meta coalition of the Worcester Food Policy, the Center, Worcester Food Policy Council, the Central Mass SNAP Coalition, and the Task Force on Food Security. So we decided to kind of tie those 3 coalitions together, forming the Center on Food Equity. And so I co-chair that along with Gina Platanino, who's on a year leave as she works in at the White House, but she'll be returning as well. I want to make sure that I am transparent up front that when I am speaking about food security, I'm not speaking from lived experience and experience in food insecurity and hunger myself. And so that does have have really strong limitations, as well as, this privileged identity that I have with being a white cisgendered woman that really impacts the way that I understand the roles and like the need for control bias that is needed there as well. But in doing this work and this research, so I am presenting on this, but I am representing, in some ways unfairly, a really very diverse and engaged team that actually led this research. So as I mentioned before, there was research institutions with the Research Bureau and Prevention Research Center and the City of Worcester epidemiology team that helped to lead this, but we also worked really closely in partnership and follow the lead of the members of the Center on Food Equity, 3 cohort coalitions that I mentioned. Many of you are here. And so, engaged in helping to guide the direction of the research, the way that we interpreted findings, the nonprofit organizations, food pantries, community fridges, senior centers, all of these things that we visited and partnered with and able to do the research. The community researchers who actually went out and took the surveys and visited sites were representative of the community, spoke the languages, and were able to engage with the resources and community in ways that I would not have been able to. We also contracted staff to lead the research who had deep community connections. Laura Martinez led our community research practices and guided the community researches. Maggie Kilcoyne and Grace Lowski were kind of the technical writers on the project, and so really came with a lot of expertise from the community as well. So that is just who I am as we center into the way that we're presenting these results. So just to give overview, so I'll go over kind of local contexts. I already started to introduce of who the organizations were, how we came to this. We'll do a little review of the foundational research that we look to understand before diving into collecting new data, what data was already collected and what we already understood about food security before this, what our guiding questions were, and our approach that the foundational research and guiding questions led us to take with our methodology, our methodological practices of how we collected data, what those key findings were, and how the key findings led us to recommendations. So that'll be kind of just like the overall flow to the presentation. So as I described before, Worcester has a long history of doing collaborative community-based work addressing food security. The Worcester Food Policy Council was established in 2006. It was first established as an advisory committee to the then Mayor Tim Murray. We then became, when Mayor Murray went on to become Lieutenant Governor, we became the advisory committee to Congressman McGovern, decided that even with the strengths of that, we felt that it was more appropriate for us to become independent. So it became kind of an independent council, not tied to a particular legislative or elected official role, but instead like a advisory body on policy issues that could advise at the local, state, and federal levels. With COVID-19 in 2020, it marked kind of a new need for collaborative communication and programming around food security. So through Worcester Together, we established a food security working group that became the Task Force on Food Security. During COVID, we started and coordinated, led a lot of programs like the Hot Meals program, which delivered meals from COVID positive to COVID positive households from locally owned Black and Brown restaurants. And we delivered about 30,000 meals to people during that time. We also coordinated food pantry delivers and supported, the coordination of folks doing that work. Many of you actually led all of those efforts, so I don't have to can really give credit to the folks here who led that, but the task force kind of provided the space to do different kinds of communication. Oh, you're doing that. Can we also pull in this partner? You're working with them. Can we work with them? Really a practical space for working together. We also found with this, new task force on coordinating services that it was a real opportunity to inform the policy work that was happening out of the Worcester Food Policy Council. So just for an example, with the COVID meals program, we saw the tremendous added value that this was giving to families to be able to have prepared meals when they were facing an illness like COVID. It also pushed us to kind of realize and face that families who are in need and could benefit from prepared meals weren't necessarily only those who were COVID positive, but those facing different kinds of hardships to be able to prepare and cook their own meals, maybe folks. And so that led us to advocate to the DTA to participate in a statewide waiver option called the Restaurant Meals Program, which we then filed legislation trying to force the DTA to participate in, and then ended up due to this kind of pushing this hand, they decided to opt into it, and we were able to now the state of Massachusetts participates as a pilot in the Restaurant Meals Program, which has expanded SNAP access to participating restaurants for folks who are unhoused, disabled, or older adults. And so folks who are coded with that status under their SNAP benefit cards can now utilize their SNAP benefits at one of two participating restaurants in Worcester, New Wine Pizza and Kitchen over near Clark University, and Sabrosa Venezuela, which has a location at the Worcester Public Market, as well as a food truck that can actually go out to senior centers and different kinds of facilities as well as open public parks and different spaces where there might be folks who are a member of one of those communities who could benefit from using their SNAP cards. So we're excited about that as a pilot, and there's potential to grow that as well. But that's just one example of kind of the programmatic work of the task force really informing our policy priorities and our advocacy. And that was an incredible value. And so we decided to kind of maintain this coordination even beyond kind of peak COVID, to establish the Center on Food Equity, which will establish more coordination between the Task Force on Food Security, the Worcester Food Policy Council, and the third coalition, which is the Central Mass SNAP Coalition, which works closely with the DTA and others to inform both administrative policies within the DTA. So that might be things that don't require legislation, but a different policy around communication or enrollment or different outreach efforts or different waivers that they could participate in for the program, data sharing. And so we meet now every other month with the DTA through the SNAP Coalition. So then these three coalitions, we've now found, a renewed interest and attention from many community members, funders around food security. But folks kind of felt confused and overwhelmed of like, which one am I supposed to participate in? Or do I have to go to all three? So we decided to create this umbrella structure. So folks who wanted to get involved in food security could plug into one or two or three of the coalitions, whatever they had capacity and interest for, but still feel connected and didn't feel like they were missing information by not attending some of the others. They could still access minutes and hear updates of what was happening in the other coalitions. So that's how the Center on Food Equity was established. And yeah, we're really excited about that. And so one of the first exercises that we wanted to do as this newly established was like, we understand that, there are, upstream root causes to food security. There's needs beyond what may be obvious to address in food security. And we were actually getting requests from funders or decision makers of, we want to do food security work. What should we do? But they didn't always just believe us when we said, oh, this could be the thing, or maybe we had limitations in the understanding of the nuance of what needs were and what could be the most effective strategies. So we decided to engage in the first community food assessment, so we could really have data and a unified and structured list of priorities for this now umbrella organization for the three coalitions to focus on with the results of a community food assessment. So in doing that, we know that we didn't want to like just reinvent the wheel. There was work that was already done. There was already research and understanding of really important factors that contribute to food security. And so we look to first understand, what does the foundational research tell us? What do we know going into this? And so we looked at 3 different sources. One was the Greater Worcester Community Health Assessment, done collaboratively by Division of Public Health, the UMass Memorial, and Fallon Health. And the most recent community health assessment told us that food security in Worcester is experienced differently depending on where people live, how they move around the city, and their ability to effectively navigate systems to access support. So this theme of navigation and access really came up. There might be resources, but people needed the support to be able to get them, and that depending on who you were, you experienced those differently. And so that was a major finding that we led to our lens moving into this. The second one was a study that we did in collaboration with Tufts University over the last 3 years, called Catalyzing Community Study. It was a national study on kind of root causes to childhood obesity. But in Worcester, we decided to focus, communities could focus on a specific element of that. And so we decided to focus on food security as one of those. And this catalyzing community studies, I'll show you in a second, but used a community stakeholder model, bringing folks into the room who experienced food security, who worked in food security, who funded food security, like all these different things, to build like kind of a shared understanding or map of what that really looks like for your life. How do you visualize and look at, yes, I make that decision, but that's based on this decision, and that's based on what resources are available here, and that's based on this. And so this is something we talked about, was like the interconnectedness of these systems, but we didn't really have a visual in order to describe that. And so that's what we did, is we developed these kind of visuals, and we looked at what were the central pivot points to each of these visuals impacting food security. And we found that there were essentially 3 major central pivot points, and that was financial resources, like how much money that you had or resources you had to be able to buy what you needed. The second was access to benefits, whether that be state or federal benefit programs that you should be able to access. It's, of course, closely connected to financial resource. And the third was demands on families' time, where we saw, yes, people may have the money, they might have the knowledge, but if you don't have the time to cook food, having, a whole butternut squash or whatever it may be isn't helpful to you if you don't consume it. And so if people, don't have the time or even mental space sometimes to plan a meal, to dedicate that time to be able to do that. And that we saw that for those residents whose needs are being met, the system can either reinforce itself in positive or negative ways. And so they call it vicious or virtuous loops. So if you enter the system of these systems at a deficit, your condition will continue to worsen. And if you can enter the system at a net positive, your condition can continue to improve, which really like displays and visualizes this phenomenon that we know about, where you say, well, the system works for me. And it was like, yes, the system does work for you. You can see, and the system does not work for me. And so that was like an interesting ways to describe that. And so I'll show you a couple of these. So this was one on, just core money in the households and how we visualize that. And so we know that money in the household is impacted by childcare and housing and the cost for medical bills. And that impacts, and has like, and also a relationship to, following this loop, the amount of money that you have for food might increase the amount of healthy food, vegetables, or fruits and vegetables you're able to buy. That will increase potentially, you're preparing the food, healthy outcomes, and your ability to work, which can then your health then, and having good health and the ability to work can then impact having more money in the household. So that's reinforcing. But if you're entering this as a deficit, it can, poor health conditions can decrease your ability to work, thus decreasing your overall net resources, like also reinforcing that negatively. And the same can be shown for, money for education and wages is the same kind of interconnected loops as well. So it was a really interesting way to like describe and show this, as well as to show that, I think of these as really like an assets-based approach as well, showing that people want to live healthy lives. They want to prepare, generally want to um, provide for their families. In a lot of cases, have the knowledge, skills, culinary traditions, backgrounds to be able to do that, but often lack the basic resources to be able to make it happen. And I think that's a different shift in perspective than sometimes we think of as kind of this like a negative or a deficits-based approach where we assume, oh, people need to be taught and coddled in order to be able to get this. Some populations that may be specific, but this is really not the general trend that we heard. Um, and so, yeah, just to say, there are three of these like kind of major diagrams with this different focus. I didn't include them all here because we have a lot to show. This is foundational research, but the three pivots of money, time, and then access to benefits, and the complicated also structures that impact those in the same kind of ways as you see this one. The third piece of foundational research that we looked at was from the Worcester Regional Research Bureau, who did a study called "Is Worcester County Food Insecure? Depends on Where." And what they looked at in really interesting ways that they showed a couple of things that they looked at particularly Worcester's rates of food insecurity, which can be kind of complicated to get as a standardized metric. However, what they saw is that food insecurity rates rose post-pandemic, and more residents were eligible for federal assistance, but were not able to connect to those resources. So like the enrollment, as we saw food insecurity increase, we didn't see the rate of enrollment in benefit programs keep pace. We also saw that Worcester residents experience food insecurity differently based on what neighborhood they live in. And just for a couple of examples of the types of research and kind of quality of visualization they have in this, we see, kind of the change in food insecurity with it increasing across Worcester County and the city of Worcester, comparing 2018 and 2020. And then we also see more specifically where we can visualize and show through this mapping exercise the SNAP gap, which is the gap between who is eligible to enroll in SNAP, and we know that through other common eligibility indicators such as enrollment in mass health, and who is actually enrolled in SNAP. And we see for Worcester County that's about 40% on average gap in that enrollment, but we saw narrowing down in some neighborhoods of Worcester, it was as high as 70%. And we can go into it a little bit further in the research that we did, but like a myriad of different obstacles and challenges as to why that gap does exist, but also points to real potential for investments that could make a difference in people's, like, again, like pointing to the credit allies and communities, like core money in the household that they might have to be then available to be able to make purchases if they had access to these benefits. So looking at, that foundational research and kind of where we were in our coalition building for work in food security, we then, did a collaborative process with like an open call over 3 different sessions for members of our cohorts to help us define what are the questions we really needed to seek to understand through the community food assessment. And this is where, we started to like really kind of differentiate ourselves and what we meant by our food assessment. And I'll say 2 things before I kind of talk about these questions specifically. But one is we needed, I'll go here, so it'll be less distraction. One was that when we talked about a local community food assessment, it was important for us to be specific that we were not only looking at locally grown food. And that is a direction that a lot of food assessments do, is they'll look at specific access to food that is grown in your city, or sometimes people find local as your county. Some people define local as driving distance during one day. But we decided not to specifically look at what it meant to have access to local food, but we meant what it be that is included, as if that is what people told us that they needed access to in order to feel food secure, then we would include that, but we wouldn't start from that framework. The other part of it is that in many food assessments, they'll look at production and distribution and processing of food as kind of different elements of the food system. And we decided not to take that approach of looking at kind of the different elements, food waste, for example, as like the different elements of the food system. What we decided to do is look at food insecurity, asking people who are food insecure, who are accessing resources in Worcester, what is working for them, what isn't, what impacts their lives and their health. And then following the direction of where that brought us. And so that was specific with Worcester as an urban center. Yes, there are folks growing food here. There's incredible, production and hydroponics and value added products that people are developing, but we wanted to honor that those are important critical resources, but there might be many people in our community who are accessing food at Walmart or at a food pantry as their sole source of food, and that is what is important to them, is that they have like a stability in the kinds of foods that they need, that make them feel healthy, that make them feel like their culture and lives are respected. And so that is the framework that we would follow in this assessment. So those kind of two like overall framing things. We're not locally grown, and we are looking at food security, not necessarily as the kind of goal in our research and the goal for where we're looking to understand food, not looking at from a framework of kind of the different elements of a food system. And so in that, these were kind of the guiding questions that we came up with to drive our research and what we look to seek to understand. Who is experiencing food insecurity in Worcester, and how does who they are impact their food security? What are the system issues driving inequities in our community, and how do different populations experience these system inequities and impact on food security? What are the food resources available in our local food system? What are the capacities and needs of these resources? How are people connecting to and experiencing them? What are aspects of our local food system do those living with food insecurity identify as most beneficial to helping them access food? What barriers, closed doors do they encounter? What ideas do they have to improve the system? What aspects of programs do community food workers identify as successful, and what barriers do they identify? What ideas do they have to better serve the community? What forms of communication are effective in helping people experiencing food security get information about how to access the food they need? And what are the shopping patterns of Worcester residents, and how do they align with available shopping options? What would make shopping for desired food more manageable, especially for those facing food security? So that's what we sought out to understand as we designed our kind of research practices. And so I have to change this picture of myself. I am not a slide maker, so I admit I did not graphically design these and put a picture of
love
myself in
that
here.
picture, Case. That's so cute.
I probably would not put a picture of myself in this, but it's fine. It's there. So we designed a methodology to try to respond to those questions. The methods focus on listening to and learning from people facing food security to understand their experiences and accessing food from supermarkets, federal nutrition programs such as SNAP, and local food pantries. And so we call this, kind of personal experience or a human-centered approach. We used a community researcher model in order to be able to collect all of the data, people from the community, designing the research tools, asking the questions. And we had 5 primary key data sources. We designed a survey using some standardized questions from USDA and Greater Boston Food Bank had developed, but also original questions designed to answer the questions for our guiding questions. We did community conversations or focus groups. We did 7 community conversations throughout the community with those people, different populations that were most impacted. We did a post analysis of Mutual Aid Worcester Facebook. Deb Powers, who's works for communications with the Center on Food Equity, is also administrator with Mutual Aid Worcester, so she was able to have access to that to really look at what are people asking for, who's asking them, what are the responses they're getting when they're saying, does anyone know if there's a food pantry near them? What are people responding with and saying? How accurate is that information? And then we also did site visit observations. We went and visited some of the food resources, talked to both clients and to staff. They weren't surprise visits. We went and visited, we told folks that we were coming. And then we also did a food pantry survey for agencies to be able to respond from staff perspective about what they were seeing and they saw needs being. So those were kind of our primary 5 key sources of data we looked at. And so in findings, first want to be upfront and who we heard from and who participated in those. And we have this kind of compared to the City of Worcester population, the survey respondents, and then also the community conversation participants. We intentionally looked to engage with folks who were food insecure. And so we did have a higher, a comparatively higher percentage of people who were in lower income brackets compared to the City of Worcester. About the same of those folks who rented, but we didn't have a comparative data for temporary unhoused, but you can see the comparative statistics here as well, and about similar in our conversation, our survey respondents with bachelor's degree of higher, but a little bit, we had lower participants who had higher educational attainment for our community conversation participants. For about 56% of all survey respondents answered affirmatively to one of the 3 questions that is used to screen for food insecurity as standard questions from the USDA, which are those 3 questions in the first text area. We also said, as saw in our data, food insecurity among households was more likely to be food insecure than households without children, and this was especially true for Hispanic households. It showed that like a differentiated difference in food insecurity rates. We also saw that the majority of survey respondents reported not being screened for food security by their healthcare provider. And those who were screened, 58% of those said that they were not then offered any resources that would help meet the need they were screened for. And that is there's a new requirement with Mass Health that they are required to screen for food insecurity, but they're not required to give any resources. So we're trying to promote that best practice as well. Shopping for food, just as kind of general characteristics, most respondents were responsible for accessing the food in their households. Price and location were most important. Deciding where to shop, service restaurants, paying for food, primarily from employment income, but also utilizing SNAP benefits. More than half of participants reported using SNAP, with much fewer reported using HIP or WIC, with only 7% each. And so not all SNAP participants will be eligible for WIC, but all SNAP participants are automatically enrolled and have HIP. And this reflects, the statewide trend where only about 6% of HIP, which is Healthy Incentives Program, which is added SNAP benefits, that anyone who receives SNAP has added to their card in Massachusetts per month that they can use at farmers markets, CSAs, and farm stands. And they only see about a 6% redemption rate statewide, and there's like wide demographic gaps in who is actually utilizing and accessing that program. Participants also reported changing their shopping habits given recent changes to SNAP and inflation, particularly the end of the emergency allotments at the end of SNAP, at the end of the COVID emergency period. We saw people really reporting that having a big impact on where they shopped and what they shopped for. The cooking at home, this was an interesting statistic because this is something that we hear a lot about in people designing food security programs. I know I've run food security programs with a heavy emphasis on cooking classes and nutrition classes. But we heard in the research that we did here, the majority of respondents reported that they did not face challenges cooking at home. For those who did experience challenge, the primary barrier was lack of time, not lack of knowledge, not the need for a recipe card. Community conversations participants reported when faced with limited time for cooking, they reported purchasing prepared food and vegetables. And so this is a note that I like to sit with a little bit here because I think this kind of just exemplifies sometimes some of the assumptions and ways that kind of biases can be baked not into not only the causes of food security, but also the solutions. And this is not to say that cooking programs are not important and valuable and useful sometimes for some populations, but not necessarily for all populations all the time. And we really need that feedback and data and partnership with community to see, is this something that is designed that will meet their needs and be a value add. Okay, and transportation is the other kind of structure that we looked at as kind of primary understanding. We saw that the most frequently used mode to get to stores and food pantries was driving, followed by taking the bus, combining a bus ride with a cab or walking. One of the other major findings that we found out of the transportation section was a real challenge that people talked about in terms of being able to bring your grocery bags onto the bus if you are bringing the bus to a food retail location, whether it be a food pantry or a supermarket, where the RTA policy is not specific to grocery bags, but just the policy is that you can't take up more than one seat. And so it comes somewhat up to the driver's discretion how they enforce that. But a driver could say you can't bring 5 grocery bags after you go grocery shopping for your family onto the bus because you need to, spill it on over to the next seat or onto the floor or wherever that may be. You can be denied entry to the bus to be able to do that. And so it's really a risk that people have to take when deciding to take the bus to go grocery shopping, that you could be denied to be able to bring your groceries. All right. And so those were kind of like core overall findings that we found. That we also looked at utilization of food and nutrition assistance programs. So we looked at federal nutrition programs such as SNAP, WIC, school meals program, and the summer meals program. We looked at HIP as a state program, and then we looked at local food assistance program, including Elder Services of Worcester, Meals on Wheels, Dining Center Meals, community fridges or WU fridges, and then food pantries. And so under SNAP, we saw that people said that they found that SNAP benefits, once they were enrolled, SNAP benefits were helpful and easy to use, but they also said that when SNAP benefits run out, they need to seek other ways to get the food that they needed. Among survey respondents with low income that never used SNAP, the most frequent response why they weren't enrolled is they didn't know about the program. They were concerned about immigration status and the way that could impact themselves or members of their household if they enrolled in SNAP. They or that they didn't qualify or thought that they didn't qualify for the program and so did not apply. Among Hispanic respondents, households with children were 48% likely to be using SNAP than Hispanic households without children. And this spoke a lot to older adults who are more likely to enroll and also be supported to enroll in SNAP benefits, rather than younger families without older adults in the household. Just a few quotes that people said. Food only lasts for a few days. Someone said it was about 15 to 20 days worth of food they were able to get. I have no food stamps because it was shut off due to not receiving my paperwork in the mail. I haven't got my food stamps. Have been calling them and they won't answer. Left several voicemails, still nothing. There's also a particular community context and challenge in Worcester that just before the pandemic, we saw the DTA, Department of Transitional Assistance location for the city of Worcester move from downtown to out on Route 20 and out near like Chuck E. Cheese and Burlington Coat Factory. And so when this happened, we actually supported a cohort of individuals to document taking the bus from their homes in various neighborhoods to the new location. And we saw from some people, it was about a 4.5-hour round trip to be able to take the bus there and back. Required walking on some areas without sidewalk, and was a really significant challenge that people who were trying to meet some of these needs, I think in these quotes, I've been calling them again and again, you would like to be able to walk into the office and speak to somebody to be able to address these challenges that you have, but it's now in Worcester um, uh, inaccessible for many people. Under WIC, respondents reported that WIC benefits were easy to use, that but the variety of eligible foods was limited. More than half reported an interest in using their WIC benefits. It was an option to shop online and use curbside pickup and or delivery. There was some pilot initiatives and maybe some development in being able to use online shopping, and there was a curbside pilot happening in Lancaster, I think, Kwame, that we were looking at and tracking. But this is a challenge. People said you can now use SNAP benefits at many retailers online, but WIC for the most part is still not able to be used online. We know families, particularly those who are pregnant, young children, this could be a particular challenge. School meals, 85% reported the meals were helpful to the household. Respondents who had reported being food insecure recommending increasing food choices, increasing healthier options, quality, fresh food options, and taste in meals. Summer Eats, which is the summer program for free meals that happens in after school time. So we used to call the summer feeding program, which is a weird name. Now they're calling it Summer Eats. So respondents who identified as being secure reported that their children did not participate because they didn't know about the program, didn't need the program, didn't know the locations, or the children disliked the food. And then a couple of quotes. It was hard for me to find information about where and when to go. I didn't go this year because they didn't want to sit outside in the insane heat. It was better when they could bring it home. And that was a change in the pandemic rules, where during the pandemic, under the emergency provisions, you were able to pick up meals and bring them home from summer spots. But now under USDA regulations, you're only allowed to eat the meals for ages 18 and under on site. You have to take a complete meal and you have to eat the whole thing on site. Any extra meals have to be thrown away. We sent a note on this. We sent community researchers to go and visit the sites and observe, and as part of our site observation process. And we found that many of the sites that were listed on the Project Bread, which is the statewide website that receives the addresses from the sponsor locations in Worcester, which is Friendly House and Worcester Public Schools. Many of the sites were listed incorrectly. The addresses were wrong. When we went to see them, they weren't there at the same time as they were listed. And so really just verified again the experience that many of the parents told us in community conversations and in the surveys, that it was challenging to access the basic information about where these resources were located and how to utilize them. Healthy Incentives Program, which is this benefit I explained before, farmers markets, CSAs, and farm stands. You get $40 to $80 added to your card monthly to be able to utilize at those resources. It's lose it or use it program. So if you don't use your benefits in that month, unlike SNAP, it does not roll, regular SNAP benefits, it doesn't roll over. There's also some other quirky things about it, but it's totally a free benefit. It's not matching, in that it's $40 to $80 additional that you can access on your SNAP card. But people said that what we generally heard was that there was a very low participation around survey respondents. 58% did not know about the program, 16% didn't know how to use it, 9% had heard about it but didn't know what it was, 7% reported it was too difficult to get to a farmer's market. I don't go to farmers markets. I've never been curious about them. I know where they are. I think they're expensive. The fruit by the pound, as it is organic and organic, is more expensive. I think that times the fruit is more expensive by the pound of vegetables. So again, kind of mirrors the statewide trends and data that we see, with only about 6% utilization rate for SNAP participants utilizing their SNAP benefits. Utilizing their HIP benefits, sorry. Meals on Wheels and Diner Center meals, we had low participation rate from survey respondents that we spoke to. Of the 96 respondents with older adults in the household who participated in the survey, 91% reported that their household members had never used the program. It could be a limitation in our survey collection, that we had limited sample sizes on this. However, for dining center meals, 65% of eligible residents qualifying as eligible from their age and income qualifications that they shared on the survey. 27 respondents, or 48%, said it was easy to sign up. 29% meals tasted good. 46% represented their culture. So some positive, but some limitations in data on what we were able to speak to on this program. Community fridges, half of survey respondents were aware of community fridges. Just a note, this was like higher than many of the state and federal programs that we talked about, that people were more aware of the community fridges and what they were and how to access them than many of these other more well-funded programs. However, 25% of those who had heard about it reported never trying to use the fridges. Most respondents who have used the fridges reported positive responses. However, those who are food insecure also reported that when they went to use the fridges, they were often or usually empty. So some limitations on the ease of use of them as well. And also, it just makes me note that we need to learn from the communication and marketing outreach that the community fridges do in order to be sure that we're making sure that people are as aware, access to information across all of the programs as well. Food pantries, over half of survey respondents used food pantries to help the households. Households were more likely to use a pantry, included households with children. Hispanic heads of households whose primary language at home was Spanish, adult heads of households with a high school degree or less, and residents who rented or lived in temporary housing. All respondents reported needing more money to meet their community food budgets or to comfortably cover costs of food and not use pantries. So we asked people, use pantries, what would it take for you to not to? How much money would you need? And respondents reported $200 to $500 per month additionally needed in order for them not to be dependent on accessing food pantries for their regular food budgets. Positive experience at pantries cited by respondents, including feeling welcome, pantry spoke their language, pantry hours were convenient, received food they knew how to prepare, that they liked to eat, it was enough, they aligned with the cultural values. Some negative responses included waiting in line, which was sometimes long, not being able to go as often as they liked because of visit limitations, the pantry out of food, feeling embarrassed about using a pantry. A quote that sometimes said is like, food pantries are helpful for those people who will go to a food pantry, but we know that is not everyone, and there is stigma and limitation sometimes associated with folks seeking many of the resources. So all of that data led us to develop recommendations. So the PRC particularly led us through a research analysis protocol that was a good professional development experience for me, on kind of triangulating the results between community members who were impacted and involved, community researchers, professional researchers, in order to identify what the common themes were that came out of this. How did community members identify strategies, what things were in motion and likely to succeed, what were best practices in the area, in order to develop our recommendations. So we developed 5 key areas of recommendations, which is at the bottom: centering lived experience and advocacy, SNAP, communication, transportation, and program access and delivery. But we kind of headlined them all with an equity-based framework because of the need of the differences that we saw clearly and that we know from research and racial equity theory, that people experiences resources differently depending on their intersecting identities, particularly racial identities. And so that we needed to assure that in any solution, any recommendations, that we're rooting ourselves in this equity-based framework. And so the equity-based framework, what we mean by that is that we need to train agencies on best practices and make sure we have shared language and framework for racial equity when implementing recommendations, ensure that community members with lived expertise with food security can actively contribute and lead the implementation of strategies and are being paid for their time. When possible, we are using data that is specific to populations, including it's disaggregated to implement, monitor, and evaluate strategies. We know that there are communities within communities. There is a diaspora of Latine communities, of low-income communities. We cannot use one brush to describe everyone's experience that we often kind of group together and categorize. We also know that there is need for additional data that this kind of gives broad strokes of recommendations and findings. But if we were to use this, develop a specific strategic plan on food pantries or on SNAP access, there would be additional research needed to dive into populations that were missed, that we didn't hear from enough in order to really understand what we should understand about the challenges and what solutions would be most helpful. We also want to use this to encourage funders and decision makers to use data-driven, research-informed, community-identified strategies to prioritize and to address food security. So we really encourage those decision makers, those funders, to not only just follow those well-worn pathways that we know exist of what they've always funded, where they have relationships, what are kind of safe bets on funding and resources and aligning yourself with, and really listen to community in order to identify things that are actually going to make the difference. And so in the 5 areas, the first one is centering lived expertise or experience in advocacy. That includes supporting community advocates with pathways, initiatives to support advocacy and civic engagement, funding those positions, and then also looking to find solidarity and connection to other coalitions and groups who are addressing social determinants of health. We see in the causal loop diagrams the way social determinants of transportation and childcare and housing impacts food security. We are not going to ever get ourselves, healthier without food security as a community if we're not addressing those things. So we need to find solidarity in those and see how we can work and leverage our networks to support each other in this work. Under SNAP, we looked at there are specific areas we need to have specific advocacy strategies for, as SNAP as being the largest federal nutrition program. There's a statistic that Project Bread often shares that for every meal that is provided by a food pantry, SNAP provides 9. And that's a significant difference, but we don't always think of that as, how to kind of manage and focus on what resources to support people with. But we know that SNAP is a critical program for many, many families. And so we can work to address through advocacy eligibility around who is eligible. There was a major initiative this year that passed and then was actually unfunded through the Feeding Our Neighbors Coalition, which restored state-funded benefits to federally excluded, legally present immigrant populations in the state of Massachusetts. So these are legally present immigrant populations who are excluded from receiving SNAP benefits because of 5-year waiting period or different provisions under immigration status that was previously funded, previously funded by the state of Massachusetts, and there was a huge advocacy campaign to restore those. It was restored, it ran out of money, and then the funding wasn't restored to it. So it's that advocacy continues, but there are ways that we can increase and change eligibility of income status, of who gets it, in order to be able to have more people to be able to receive this critical benefit. We can support people with enrollment systems through common applications through Mass Health and other benefits. If right now there is a common application button or box you can check, but it refers you to a SNAP outreach partner. It doesn't automatically enroll you at the same time. And so how can we streamline enrollment more effectively for people, eliminate some of these barriers by just having those common applications? And we increase the monthly benefit amount to reflect the true cost of food. The last time this has been calculated is many years ago, and there's opportunity in the new Farm Bill in order to recalculate how they are determining how much money people need, and expand opportunities for all SNAP households to be able to use their SNAP benefits for hot foods at grocery stores and restaurants. Right now, you can buy a cold rotisserie chicken with SNAP, but you can't buy a hot rotisserie chicken with SNAP. Wanda, I see your hand raised. Did you want to do a clarifying question? We're also going to do like more of a time for questions and stuff at the end too.
Go ahead, Wanda. You're on mute though. Jump in.
I think you're still on mute. If you're talking, you're still on mute. But maybe
All right, Wanda, we're waiting until the end, but work on that mute button.
Yeah, let us know if you want to like
unmute. I'm sorry.
No, it's
I
okay.
was fighting with the unmute button. I'm asking just for a clarification.
Sure.
Because I joined just a little bit late, and I'm loving the overview so far. I've been throwing my comments in the chat. So did I just hear you say that they're looking at revisiting how Massachusetts does it independent of our federal, like us? Am I misunderstanding that? Like we're gonna take on our own a food stamp thing, like we have our own Mass Health, but like Tennessee has no health coverage. Is that what I understand you saying?
It was state funded benefits that were state funded. They still were issued DTA cards like the standard cards, but they were funded through the state budget rather than through the federal budget for the particular population. So it wasn't like our whole own SNAP. It was just this funding for this population that wasn't funded by the federal government, came from the state budget.
Okay, so that was just my clarification because I did join a little late. I apologize, and I'm patiently waiting to the end.
All right.
Thank you.
Good. Yeah, no worries. Thanks. So we also looked at, we need to work more closely with the DTA as they're determining, where there's the need for office locations, for the way that they do outreach, the way that they support enrollment support, way that they manage case management, all of these things. So really forging a more closer participation there, targeting, prioritizing enrollment to populations with low SNAP participation, knowing that people may opt out, but we don't want people to opt out because they have misinformation or they don't have access to the application materials that they need in order to be able to enroll. Reinforcing SNAP referrals between agencies like Worcester Public Schools, Project Bread, other places where we can, work with wraparound coordinators, folks who are meeting with, potentially eligible populations to be able to support them to give the information that people need. And then strengthening SNAP outreach and application assistance through agencies, SNAP outreach agencies, and the Resiliency Center at Worcester Community Action Council, who has a SNAP navigator that actually goes out into the community and helps to enroll people at sites as well. And they also host community clinics with a kind of centralized referrals and resources for a variety of different resources. Next on communication. Oh, sorry, it's like some weird text there. But on communication, as you heard in the findings, this was a major threat throughout mammograms. They didn't know where the summer meal sites were. People didn't understand what food pantry they're eligible to go to. They didn't know how HIP worked. They heard other things about SNAP that weren't true. So having equitable, easy access to information was a critical finding. And we need to ensure that food resources are now available in food pantries, human service agencies, those supporting children and families, such as Worcester Public Schools, and then we have like regular easy. We also want to make sure that we are very doing specific, targeted, prioritized population outreach to the communities that we know that there are gaps, and making sure that it's in the languages, in the way that they receive and trust information. And then we need to increase healthcare screenings and referrals. You know, we need to go beyond screening for food security to screening for food security, plus providing resources through community health workers and warm handoffs and navigators, but also not only screening for food security, but screening for federal benefit enrollment, so that we can really understand what resources people are currently accessing and how we could help to kind of shape those referrals more effectively. Transportation. So we advocate for transportation improvements related to food access, looking at food access strategies for advocacy with existing transportation coalitions, evaluating bus routes and schedules to look at where they are going, how long it would realistically take to go to Market Basket and back, or wherever you need to go, strengthening public transportation policies, you know, relates to specifically around the bag policy and other things, our shopping, shoppers, what are those called? Shoppers routes, or things that we can help support with, and then improving active transportation, so we have connectivity between those sidewalks, bike lanes, bus routes, so that people can, you know, do a complete route to wherever they need to get to. And then the last program strategy area, and we intentionally put this last, is program access and services. And so we put this last because we know that this is often what everyone jumps to. It is vital and critical that we have the food pantries, the community fridges, the meals programs that we have. People need them, they rely on them. We need to make sure we are honoring people's health and dignity by providing and making sure these programs are strong. We also need to address what is causing these to be such needs. And so oftentimes there's also a strong tendency and push from funders and legislators to fund something they can see and touch, they can put their name on, they understand, oh, food security, let's give someone food. Where giving SNAP application in my most pessimistic way, SNAP application support, my most pessimistic voice, makes me feel like they don't want to fund that because they can't have their staff volunteer there easily, or they can't put their logo on a SNAP navigator in the same way as they can a new shelving unit or a van. However, it's also because people often don't understand the connectivity and the causes to this. And so this is really where the importance of this research is to frame that these are the more upstream issues that we also need to be prioritizing and funding in order to be able to eliminate the needs that we're going to always have without these more systems-based solutions. We cannot food pantry our way out of food security, but we can meet people's immediate needs, like so many of you are like heroically leading that work now. And so some specific strategies that people said here, but we put it last because we know this is just what people will flip to and want to go to, is supporting improvements to school meals, expanding the healthy incentives program access with this very low participation rate, reducing food pantry wait times, increasing choice models, increasing access to fresh fruits and vegetables, were direct strategies that came out of the survey and conversations as well. And so that's just about it. So we are building at the Center on Food Equity as one way to get involved. We are, kind of building a structure for ways that people can plug in and participate collaboratively in these solution areas. We have these three major coalitions: the Worcester Food Policy Council, the Task Force on Food Security, and the Central Mass SNAP Coalition. And we're forming subcommittees that align with the priorities and recommendations that we identified in the food assessment. So federal advocacy, state advocacy, local policies and transportation under the Food Policy Council, SNAP, Restaurant Meals Program, advocacy, summer meals and information under the task force. And then the Central Mass SNAP Coalition looks to work closely with SNAP and DTA. I met with folks from DTA earlier today looking at a satellite potential location in Worcester to try to address some of the needs. We're moving forward on many of these things, like as we're doing it too. There's also, so many organizations doing this work. You don't have to come to our meetings in order to engage. This is the work, but we do want to provide opportunity to carry this data and framework with you as you're applying that, whether that be in collaboration with Center on Food Equity and these coalitions, or in your agency communities where you do work as well. There's 3 different websites. The Center on Food Equity gives kind of the overview. It also has the link to the full community food assessment. So this is just the PowerPoint. This is like an 80-page document that you can download on the Center on Food Equity website as well. We also have Food Policy Council, looks through our policy priorities. And then we have Food Help Worcester that just click on, that was designed to be kind of a coalition landing point to learn about ways to engage, but it's also community facing in order to be able to centralize community resources on where food pantries, where school meals, where farmers markets, where all these resources are located, trying to address some of the needs in communication and challenges that we saw in communication as well.
You might have to reshare that. We can't see it if you're showing that.
Oh, sorry. I think
That's
I
okay.
did something.
It sounds awesome.
Here, let me show this. I think I did something fancy where I just shared that window. I didn't share this. So here's the Food Help Worcester. Thanks for telling me. Can you see it now?
Yeah.
Okay. Yeah. So this is the Food Help Worcester website that has, listing of,
Oh,
where
nice.
you can provide application support. These are all live links. So it doesn't, it's not a static list, is wherever we could. So there's, lots of opportunity to plug in there. I'll just go just so you can see. So the Center on Food Equity site as well has some of the data points, but also has the full report, including our appendices, which is our survey questions and blah, blah, blah. It has a video of the release event with the speaking remarks and things. And it also has the link to these slides and our link for our calendar. So opportunities and ways, but I'm also happy to just talk to anybody too. And then that is it for my presentation.
Casey, that was so comprehensive, amazing, wow. There's so much to dive into. I'm so proud. It was so beautiful. It's so amazing too that Worcester can be that influential, and that Gina's in DC, and that we did that, we did that work. That's I mean, I feel like I was tuned into it, and I still got my mind blown by some of the findings, and some of the innovation, some of the achievements, and some of the things that, like the hot meals program, that was incredible. The work that we've done on getting free transportation, the work that we've really done on looking at root causes, the recognition that this really, lived experience, that's my soapbox too. Let's find out what's really happening to people, instead of the people that are making policy are making assumptions based on their experience. And that's so different than other people's experience. We had, there's a lot in the chat, and I know it's really hard to follow or see it while you're presenting. But there was a lot, that the whole piece you did on sort of, I think I had it right, the vicious loop and the virtuous loop.
Yeah.
So
Yeah,
that was great. Because that's so true. That's one of the underlying principles of trauma. I don't say it that same way you said it, but I kind of just usually say it the trauma is just the first bad thing, and it starts the next bad thing and the next bad thing, right? And at people in the chat were say that again, because it's so resonant. We've all seen it. we see it a million times, a million ways, like the rich get richer. Like we just see this play out so often. And I feel like it's seeing it and addressing it is where we can really make some change. I also love that you went there. You like went to the pantries, you talked to the people, you interviewed people, you have people here, and you went on mutual aid and you lifted up the communication that's happening on mutual aid, and you used Deb Powers, and how is she, like, that's mind-blowingly incredible. I'm wow, it's so great. And I know that many of the people are here right now, so I hope they jump in. And we don't have any sort of scripted order, so people can just, I know Kwame is here and Mari's here and Barbara Mudd is here, like people who have been doing stuff. I hope will jump in and give their perspective or ask their questions. And Casey, we were saying this before, and you highlighted it, food insecurity looks different for different populations. I know in rural communities, it looks real different. They can't get to food, like they can't get places. It looks really different for veterans. It looks really different for new moms. It looks really different if you have a disability. It looks different for so many different populate for elders. We sort of had the Meals on Wheels thing going. But as you said, we didn't get tons of representation from that population. So please, we have some time to really have a conversation about this and hear from people what you're still struggling with, what's really working, what you really want to see different. Jump on in. Go ahead, Wanda.
So my church has an amazing food pantry option available currently. I wish many could afford to do the same. They may not be in the position to do, so I get it. But we have a QR code, and that has been amazing. On Thanksgiving, had to sit in a line as a disabled person in the front of the church. And by the time I got to the door to get in to get my bag, I had been sitting there for 2.5 hours, literally freezing. I saw one person who had one leg told to not cut the line and get to the end of the line. And so I would love to see, I have spoken to my pastor and they've been trying to address these issues. So that's wonderful on my church. But I would love to see these food pantries take into consideration, at a minimum, people with disabilities, and not somebody that just shows up with a cane so they look like they have a disability, but people that they're familiar, like you got one leg. It's obvious you're with one leg. That's a given. You're in the scooter. That's a given. So there's a food pantry on Piedmont Street. Amazing, amazing organization. I struggle to get up the little hill and wait on that line to get to the line. Been at the end of the line often, and been told to not let anybody else on the line to help them out, which I did, and that didn't work because people are hungry, right? And so one of the things I didn't hear, because I did join a little late, I'm upset personally. My husband and I, we're 2 seniors. Well, I'm not really a senior, but I'm considered senior because I'm over 55, but I'm almost 60. That's close enough, whatever. And he's over 65. So that makes us in that world. We only get $286 a month for food stamps for the 2 of us on a $1,300 a month income. And that's our income combined for disability because we got married. That we messed up on, but whatever. I never do that again in my lifetime because that's a contract with the government. And I feel like the government needs to step back just a little bit sometimes because, for example, during COVID, we didn't have the seriousness of food insecurity as we do today and as we did before. because they doubled our stamps. And so I'm sorry, I'm yelling. I'm passionate. I apologize, people. I and my family were afforded something we've never been afforded in my entire life of being in the system. And that was access to fresh fruits and vegetables. Now they have their stupid friggin' go to the farmer's market. Well, no, I've been there and done that. I don't want a head of lettuce and 3 strawberries for the $40 that you're going to give back to me. That's like going to the supermarket and have to buy 2 of something to get 1 free. I didn't need 2 to begin with. How about the buy 1, get 1 free? How about you just give me the $40 to spend at Shaw's or Price Right or wherever I happen to be shopping? How about we don't have to buy it and then get it put back automatically? It makes no sense in my mind. So me and my husband, we live without that service that is provided, that I have access to, that frustrates me, and I can't deal with what comes with having to deal with it. You understand? And so this is the fast one. And so I'm just saying that I think during COVID, if we're all looking at this from before and after, we're in a conversation because government wants to act like they're stupid and they don't see what we know. They're sitting there eating steak and potatoes tonight while we're lucky to have oodles and noodles and a hot dog that's not even a real hot dog. Just saying, right? And they're thinking about what we're going through. You don't have to think. You know what I do? I personally bring politicians to my house to eat. Literally. And that way they can come in my house. They can see what public housing looks like. They can see what my refrigerator looks like. They can see what my little $286 for 2 grown folks is when you got a young person, a single person getting the same amount of money. It makes no sense in my brain. And so when we evaluate as a society our abilities to, during COVID, accommodate those people who could afford not to get sick. We don't want those people's cooties. We'll give them what they need so they can stay away from us. Everything was workable. And then the COVID, everything expired. And then this crisis was reignited, in my opinion. And my question to everybody on this Zoom is, how do we navigate that piece of, and at least get Massachusetts to entertain, listen, this doesn't make any sense. Because you know what I do know as an advocate? I know that the Housing Authority, I know that the state of Massachusetts, I know Foods, I know all of those programs, they have reserves for emergencies. This is a crisis. And I don't eat. Amy, last time you saw me, Kwame, you just saw me recently. Reverend Tally, I was just at church on Sunday. I'm lethargically thin and icky and disgusting. I'm so sickly because I can't afford to get the handful of things that might satisfy me in order to eat, because I'm worried about my husband being able to eat. And so I struggle personally with my own eating issues from gastric bypass, which they don't consider that for a lot of people either. You got to eat 6 times a day. So there's lots of things in people's individual stories. And I think these blanket systems are a failure. And I think they always have been. And I fought on my public housing route of my life, but I worked with those community fridges. I helped Maria Ravelli start those fridges. I used to do the driving and the delivery and go pick up 15 boxes of donations from Shaw's twice a week and drop them off to the 5 different fridges that we had way back in the beginning and yada, yada. You know what I'm saying? And so I struggle with frustration on how to make this better for everybody, because Reverend Tally, for example, as my pastor, I didn't mean to put him or the church on blast, but they've done an amazing job, because when they did that QR code, you know, he asked me when I showed up, Sister Wanda, how's this working for you? I said, it's amazing, because I can sit in my car till it's my time to go into the church. And that way it makes it more amazing, because I'm not standing like I had to for Thanksgiving for 2.5 hours, literally cold. Like I was almost left the line a couple of times and just gave up because it was that windy and cold this past Thanksgiving, that we were waiting for our pickups. And it wasn't the church's fault. They were well prepared. There was just that many people who were hungry. Well, if you know, and you don't need, listen, we don't need a goddamn study. I'm sorry to be swearing, Rev, but we don't need a study to tell us that people are hungry. When you see people picking out of garbage cans, you know they're hungry. So let's stop playing the political politics of Messyville. I did good on that one, didn't I? On Messyville. And let them do what they got to do, but do it the right way. And with that said, I'm going to shut up and I'm going to figure out how to lower my hand. I'm a little slower because that's the other thing that these organizations like the food stamps, they don't know. Elderly people like me, we're not internet friendly. It's hard for us. Give us something easy. Text us, hit a link. Yes, we want it. Whatever. I don't know. But that's something that's usable for those elderly and those respondents that Casey spoke of who they didn't get information from. They didn't get information from because they're not utilizing it because they don't have what they need to fulfill their needs. And unfortunately, they don't feel they have anybody to relay that to. So I speak on behalf of those people that I personally know that have had those conversations with me. And now I literally shut up and let other people speak. Thank you.
So one thing I was just going to say that made me think of was I saw like Representative Hayes speak from Connecticut recently, and she said, you know, hunger is a policy choice. And so, you know, like we like you said, like during the pandemic, we increased people, everyone got the maximum amount of food stamps, you know, irregardless of their like waivers that they submitted and documentation, everyone got the maximum benefits. And we saw hunger significantly decrease with child tax credits, you know, during the pandemic. We saw childhood poverty decrease. We can make the decision to decrease hunger and poverty, but we don't. We are making that decision. And I think that that's something we don't always say out loud. You know, this is a choice we are making to keep people poor and hungry.
You're muted. Sorry.
Thank you. Just wanted to say, I do agree with everything that has been said so far, and thank you so much for the study and the report on that. It's really, I think like Wanda said, we don't need it to know what's going on, but we definitely appreciate it happening because policies are not necessarily drawn from just from stories, but also from data. My frustrations, I can say a lot about my frustrations, so I'm not going to go there, but I'm glad that there is collaborative work going around in the city and the county, definitely the state, working at a community health center, which I'm not representing the community health center right now. I'm just here as an employee who gets vicarious trauma from having so many people that exhaust their SNAP benefits, exhaust the use of food pantries, and still don't have enough to feed their families or feed themselves, and we have no ways to help. How do we collaborate even more? This is the stuff that you said about how the SNAP outreach. We're working on that. We used to have it. We don't have it anymore. And we're working on the Resiliency Center getting back and getting here so that they can help our patients. But I constantly think of what other ways can we make this easier? What other ways can we help people actually meet their needs? And two things that I will like to point out is one, the culturally appropriate foods, it's massive how there isn't enough for the large diversity that we have in the city. And whenever I tell patients about this, patients who are not Hispanic especially, they know the food pantries are there, but the food that they know they will get, it's not food that they are used to consume, know how to use, or anything of the sort. So I understand that it can be difficult to satisfy the needs of every single community or every single subgroup and community, but how do we do something about that? It's also a question I've had. Would love to hear a suggestion or response or something or work done around it. And then the other one is the food for seniors. So whether it is the senior center or Meals on Wheels, any senior that I have referred there to either place, the senior center is better than Meals on Wheels in that sense. It has been better than Meals on Wheels in that sense. Has had something to say about how they are supposed to be eating healthy foods, unprocessed food, etc., but they cannot get this through the resources that they are being provided. And there is nothing that we can do about that. Again, vicarious trauma is huge with us because of this type of reasons. So Meals on Wheels is a huge program that I don't expect that we can change, but what kind of, I would love to speak, to have more conversations around how to collaborate to address those needs. Thank you so much.
I don't know if there's anybody else on the call, like with more experience with any of the programs that Sadie mentioned or would like to talk through too. I'm happy to, we didn't have as many results from the programs, but I'd love to hear insights. I think it's what, if people are being referred to it, we need to make sure that they're actually meeting the needs and being useful and people are, feeling like it's helpful.
Yeah, like I think I really thank you both Saidi and Wanda for sharing your thoughts. Like I was like clapping along at home. Like I really agree with everything that's been said so far and it really resonates. I think that something that does get like swept under the rug because people are just prioritized on like, well, people need to eat is the taste aspect and quality of food aspect. It's so dehumanizing to see the quality of food that is like they say that is like acceptable to feed to people. I worked for 2 summers at Youth Connect, which isn't even like, I would say that there is like a level of food insecurity that's being addressed there because it's like the kids are getting lunch every day, but the lunches that they were getting were like the expired school lunches. We didn't even have the right facility to properly warm it up. They were getting half frozen chicken nuggets, hard rolls, and it was just gag worthy type food, and they were expected to eat this every day. And I've seen the same thing we were talking about Worcester Eats, like when the food quality is so bad that parents would rather their kids eat nothing and the kids would rather eat nothing than eat the food, like that's saying something. So I think just like in terms of like making food that tastes good and that is actually like, I don't understand what, like technically these are nutritionally balanced. There's an apple, there's a meat, and there's like a carbohydrate, but like they're so disgusting that I'm like, how can the people in power and the people making these decisions for like what types of foods they're getting? I understand there's like quantity over quality at some point, but like how could they be pushing like, oh, these people are choosing like unhealthy meals and these people are like choosing to eat processed foods when like the foods that are like nutritionally quote unquote balanced that they're providing are absolutely disgusting. I think that there are a lot of nutritionally balanced and like delicious healthy foods, but they're not the foods that you're providing to people as the like healthy options. So I think just actually having some I'm not saying a 5-star chef, but like someone that knows how to make good food that's nutritious and yeah, just like I don't know where in the food system those decisions need to be made, but I just see it over and over again, like literally almost inedible foods being given out to people who just have to choose whether to take it or go hungry. And I think that's a really dehumanizing place to put people in.
Hey guys, it's Mari from EBS. So on I definitely agree with a lot of things that other people were saying, and it's true, right? What you just said is like we don't want our kids to eat expired food, expired canned goods, and that's like the thing that food pantries are always giving nasty food, blah blah blah, and that's something that EBS make sure, because if I'm gonna eat it, you're gonna eat it. And then also with Sadie, one of the things that I would suggest, right, because I keep always saying this, that food is medicine. And the fact that we want to make sure that our families are getting the healthy foods, especially the fact that my organization sees a well diverse crowd. So I try to build relationships with other organizations and partners so that I can get those multicultural fruits and vegetables. So for example, we just partnered with Boston Gleaners. I partnered with the REC. I also, partnered with, Worcester County Food Bank is one of our partners, right? And the fact is that as long as I get all these partners coming in together, collaborating, my clients are receiving those fresh produce. Because that's one thing that we do, my staff, is that we inspect, we look, we try to figure out. Also, our pantry is open every day. My public food pantry is every Friday for the public. So if you have a client, if you are in need, if you need food, you can always come by the office on a Monday or Tuesday, say, I can't wait till Friday. I know Wanda has called me and say, hey, Mari, I can't come on Friday because your line sometimes is too long. You, of course, come over. Like, I'm not going to have you wait. So it's really building those relationships with your neighborhood pantries or churches if you know that they have pantries, right? And you guys are all more than welcome to visit ours. We are located at 39 Piedmont Street in Worcester, Mass. And I serve all Worcester County. I don't care. We have food, so that's what it's all about. It's all about making sure that we're showing love, compassion to our community, making sure that we are providing those services to our community. And we're so blessed that we have an abundance of food at the organization that we're able to provide. And say you're right, a lot of people don't want the canned goods, and I've seen it myself because we ended up becoming a food choice. So you're able to pick and choose what you want. So everybody tends to go to the protein, to the meats, to the chicken, to the fresh, because I mean, I gave out bags of cherries the other day. Those are $18 a pot, like bananas, from peaches to pine. Like, that's a blessing in disguise. But then also making sure that our clients know about SNAP benefits, know about HIP benefits. So we have Blanca from the WCAC coming over, so making sure that we're advocating and educating our clients that come in, so that's one of the things. And I also wanted to point out about the Summer Eats. We were also a Summer Eats site, and I saw a great turnout. We saw way more kids coming over to our site because they were able to eat at our site. And it was an indoor, there was AC. So there was a lot of positive, things going on. And there's a lot of positive things going on in the city. And Casey, this, oh my God, like, this is amazing, right? And we still have a lot of work to do as a community. And then we're still missing a lot of organizations, and we still need to do more collaboration. And that's what it's all about. We got to work together. If you're passionate about this work, if you're passionate about the community, let's continue working together. If no one knows me, my name is Mari Gonzalez. I'm the director at El Buen Samaritano, translation, The Good Samaritan. And yeah, feel free to email me, call me. If you have clients, social workers that have clients that are unable to come to visit me on Fridays, just shoot us an email, call me, and we can make it happen for anyone. So I just wanted to share that.
Thanks, Mary. Before Wanda goes back, I want to say I do send almost anybody to your food pantry because of the food choice. And I tell them that. I have had, for other pantries, I've had comments on how they cannot get some, like when they get there, they just they just feel looked down on. And that has never been the case with your place. So I emphasize that. And it's just something great to have. I wish there were more places that people could go to, for sure. But I will definitely send you everybody that I can that has different cultural needs, for sure. One of the most present cultural needs is halal food. I don't understand why this isn't something that is more widely spread and available. But I also do understand that systems cater to specific groups, and that isn't always a group that is thought about. And then the other thing is transportation that I forgot to mention as well. Whenever I actually have people who can go or are willing to go to their pantries, then they say something like, I can't drive. And then they live with chronic pain, they live with arthritis, they live with all kinds of situations that they don't look disabled, but they cannot, there's only so much that they can carry when they are taking a bus or two to get to a food pantry and back. And as you said, Casey, how the study showed, 4.5 hours of a day to go to DTA to try to solve a situation, or 2 hours on the phone waiting in line to get answers, or even just get hung up on. It's impossible for someone who has to work, has to take care of children, has to take care of themselves. And yeah, it's just it's such a large systemic issue that also berates me. But thank you so much, everybody who's doing something about it.
Hello?
Go ahead, we're hearing. Go ahead, Wanda, we are listening at you.
You're muted again, Wanda.
You are on.
Okay. I'm hoping it's my turn. Marty, thank you. I love you. You're a blessing to our community. All of my friends who know me, I don't got to name you. You know me. I know yous. Yous know what I've done. I'm not as visible now lately because, as many of you know, I'm not well. However, to the woman that I missed her name, very amazing. And a minute ago, I'm scrolling. Phoebe, yes, Miss Phoebe. I loved what Phoebe had to say, and it made me think of something that I have available that my husband and I utilize. However, because it's not necessarily stuff we use, we pass it along to the next family that will. And so for Phoebe to know, there is a church in the city of Worcester that calls my husband. I don't know how he got connected with them, because he don't even go to church. So how he got connected with them, it might have been elder services. Not quite sure how it worked out. But they call us once a month for food delivery for him. And they'll bring us like what I'd go to you on a Friday for, Marty, when it's just a pickup, not the ability to pick, but just to get the box and go type situation, right? Prepackaged box. So things like the fish sticks, they're amazing. I eat fish sticks. I can't eat those fish sticks. I can eat like 3 out of the bag. So it's way too much for myself personally. So I end up passing that along to a family that can utilize it, right? Because what's 3 fish sticks? I'm not going to open the bag when I can give it to my neighbor who's got 6 kids and they can have the whole bag, you see? So it's beneficial in that regard. But for our personal need, for example, they just brought the box this past Wednesday, and we got some apples, some tomatoes, some zucchini. That was our fresh stuff, minus eggs and boxed milk and that type of produce stuff, the plastic wrap cheese and things like that they give you for produce in the food pantries. And then we had the freezer goods, which was some frozen vegetables, the broccoli, I think, that my daughter ended up taking for her children, which I was happy for, because there's no way my husband don't even like broccoli, but I'll eat it, but I'm not going to eat that whole bag. And so I hear what Marty's saying in regards to those people who get it and they dump, because as a person who delivered to the community fridges, I struggled putting things into the fridge cabinets because everybody who went to either the church, my church on Friday, who gave amazing fresh stuff, I'd find it all in the fridge. Marty, the same thing. I'd find it all in the fridge. Like good stuff, and not fresh stuff like, that they might eat, like apples and oranges, but things like leeks and scallions and that type of items that come to these pantries that are grown and offered, but a lot of people don't know what to do with. Going back to those cards, some people don't know how to read. I personally get those cards and feel like I know how to cook. And not to be funny, listen, I know this is going to sound funny. Please, nobody take offense, because I'm just brutal when I say it, but there's a certain group of people that don't know how to season their food. I'll just leave it at that. And with that said, there's certain food y'all eat I don't know how to season myself. So, like, for example, my Italian food, it tastes like Spanish food because everything I make is Spanish food and Spanish flavored. So my Italian food might not be quite Italian-y for the Italian person, right? How do I use scallions? I don't understand. I don't know how to read. And so these are things that maybe what we want to do in places where there's access. And I don't know who would have this, maybe the senior center. I've never been there to see what their facility looks like, but maybe they have a kitchen and they could teach people like firsthand how to utilize some of these things, and not just for seniors, but for the community in general as a general partnership. Because what I see as an almost 60-year-old person, we are reinventing the wheel by trying to put a square wheel on a round rim. It's not going to work. You're going to have a bumpy ride, people. How about we get better tires for the round rim? That makes sense in my brain. Make a better quality tire. And how do we do that? Collectively, we utilize what we all bring to the table and strengthen the actual tire that's round, and not try to make a square tire fit on a round wheel. And so I know when I did food security in the 80s, and I don't know who's here long enough to remember, there was a time I lived in Great Brook Valley, and I worked I was, part of the Valley Residents for Improvement. I was the head of the tenant organization, and we used to do food distribution, and we used to get the USDA food to pass out to people. And the butter, the cheese, all that great stuff we don't have access to no more. We got the other stuff, but whatever. Anyway, so we would go and have to look literally, physically, with paperwork in people's cabinets and refrigerators to document that they were in need to provide them with food to begin with. That was humiliating. We moved way past that. But why can't we somehow reach those families that are secluded and able to talk to maybe the outreach person from the organization? For example, because Marty, you're the face I'm looking at because you're right here on my screen. You have an outreach coordinator. Not that you do, I'm just saying theoretically, right? That coordinator says, we have 30 people that show up here at least once a month to get food. How can we accommodate them better so that they don't got to navigate that little hill and all of that, right? Is there a way we can address that as a community? Is there a way for our organizations to get grants and Visa cards to volunteers who are willing to make these deliveries to those people that are in need. No, we're not going to be able to cure everybody's individual needs, but there are certain communities we didn't hear from for a reason. And so let's start at the people we didn't hear from most, in my opinion, on trying to address some of those needs, because maybe that's a smaller issue to address currently in regards to the large picture. I don't know, because I haven't been involved in all of this, but I'm just thinking, brainstorming, that might be beneficial. And again, that church I was speaking of, and I'm not naming because I don't need to name them. I just wanted Phoebe to know that in Worcester, that was an available option. And so for people that aren't directly in Worcester, or even those who are in Worcester, maybe within your own churches, that's an option to be considered for those people who are considered housebound. And how does somebody become housebound? Maybe it's up to the individual organization to determine that. I don't know. I'm just saying that there are lots of people, you know, I'm not speaking to the people who don't want to listen. I carried 2 kids and groceries on a bus. And I get that you can't take much groceries on the bus now. That's an RTA issue. And maybe they got to partner with us and know that on certain days, there's going to be people coming with 5 bags because they had to go to the food pantry and they needed 5 bags because they couldn't carry one heavy box. Whatever it looks like, I don't know. But I'd be willing to be a part of a brainstorming committee going forward on how to address some of these ailments. I also wanted to acknowledge un token boricua, I think it is, and maybe Cafe Neo, but I'm not sure if it's Cafe Neo. It could be another one. One of them was doing Spanish food, and the other one was doing Asian food for, I think it was Meals on Wheels, because Meals on Wheels was nasty. And so they had tried to accommodate on a cultural, but in my community where I live on Hooper Street, we have a lot of Africans. We have other than, and we can't accommodate everybody, but we can try to make sure that those people aren't ignored. And how does that look going forward? And now I'll shut up again. I'm sorry.
Mari, I don't know if you're getting ready to jump in or
No, I just realized I have a meeting at 2. I was like, oh shoot, I have a meeting at 2.
oh, okay. I don't know if Barbara, Mud, you were gonna say something before. I know you do the fridges, and Kwame, I don't know if that's just a random thing on your Zoom screen with the X in the corner, if you wanted to talk about WIC at all, or if anybody wanted to respond to any of Wanda's ideas, which so many good ideas. But we do have a few more minutes if people wanted to say anything or jump in. I know it was so much information, and I just really appreciate people's attention and all of the ideas, and just that people really care about this issue is very inspiring. Barb? Thanks, Barb, for all that you do.
No, I'm not, I can't, yeah, I first of all just want to say that it is incredible to see the numbers of people here and what everybody's doing and where they're from, and all the work that's being done. It really is. I don't know if people saw Bill Shaner's article about caring for others, and it being a, you know, shouldn't be, but a shift that we want to continue in the city. You know, things are changing some in the school system, and it's just really incredible to see everybody here. And also thinking about the whole vicarious traumatization of, I mean, I was reluctant to talk because I do volunteer work for community fridges. And as everybody said, it's very much a mutual aid effort where community is coming together to organize and exchange resources. And every single issue that people mentioned here today, I've seen over the last 2 years, and it's really difficult. And I did want to comment also on the empty, how people go to the community fridges and report that they're often empty, because you can do a huge delivery of fresh produce, say from Trader Joe's, and a community of people will meet you there, and it will just be gone within, it will just be gone within 10 minutes. And it's truly heartbreaking to then leave and see people come up who are unhoused or whatever, and there's, nothing in the refrigerator. But the fridge does get, people are coming all day long and putting things into the fridge, and the community fridges have shares with farms, so they're delivering a lot of fresh produce in the summer, which is great. I really like the idea, while we have everybody on here, of is there some way that we could, organize more and collaborate more, because so much work is being done. And I have to say that I was really, I'm do a tiny thing for food insecurity. Believe me, it's not. I do some regular runs, and I talk to a lot of people, but I was unaware of how much is actually been going on. And so I don't know if there is a way for some of the folks that are here today for us to continue to maybe meet and brainstorm and organize.
Yeah, I mean, I would say one way is, our task force on food security, many people here attend, but it's open meeting, meets the second and fourth Tuesday of every month from 9 to 10 on Zoom. So that's one thing, the task force on food security. I can, if you want to just, if people want to be added, you can send me your email and I can add you. Also on the website, there's a calendar you can look at. It has the Zoom link, so you can just sign in too. You don't have to be on the calendar invite anyway. And then the Worcester Food Policy Council is also an open meeting. We work on more policy issue, local, state, federal policies. That's the third Thursday of every month from 10:30 to 12. And then the Central Mass SNAP Coalition meets the second Thursday of the month, works particularly on SNAP issues. And they meet, the second Thursday every other month from 10 to 11. So all open meetings, I'm always happy to plug people into, or you can see about the calendar on the website too, if you'd rather do it that way. That is one way people can plug in.
Oh, great. Thank you.
Casey, I'll get any links you want to send me and the presentation. I'll post all of that. Every Trauma Training Tuesday has its own landing site with all of the resources for that topic. And it's designed that way. So like, if you know somebody who needs information about food insecurity, you can just send them one link. And then from that one link, they can watch the video on their own time from the comfort of their own home. They can find all the resources in one spot. So it's designed to be self-help with built-in privacy from the comfort of your own home, get all the resources, and easy to get people access to what we know for help and support. So perfect, we're right at time. Casey, thank you so much for your work, and everyone here for being here and for what you're doing, for participating. It really is beautiful to know that there really are so many people that care. And I know the people here really just represent so many more people that genuinely do care. And there's a lot of reason to have hope in these dark times. So I appreciate you all so much. Thank you. Thanks so much. And thanks for being here. Take good care. See you next month, if not sooner. Bye.
Bye.
Thank you.